The number of fully vaccinated people catching coronavirus in Ohio is a mystery. Breakthrough case reports include only deaths and hospitalizations, while Indiana's stat sharing goes much further. Some health leaders insist less is actually more. Reporter Larry Seward went to Ohio's governor for some answers. Larry, how could less information actually be better?
Craig, as with the COVID-19 testing that's just wrapping up here at the Urban League, accuracy is the governor's priority, and his advisors think that their health data reporting strategy minimizes mistakes. In the name of transparency, weekly stats show how many fully vaccinated Ohioans die and lie in hospitals from COVID-19. Missing are numbers tracked in neighboring Indiana that tells public health officials a story about the rate of spread in communities around the Hoosier state.
One recent day, 10 to 15% of the patients that were in the hospital had been previously vaccinated, but that number goes up and down.
Dr. Tom Huth works for Reed Health in Wayne County, but he's also Chief Clinical Officer for Franklin County Public Health. Both feed data to state health staff who track breakthrough infections in a painstaking way. They take two databases, a registry of every fully vaccinated Hoosier and spreadsheets full of daily positive COVID test results. Staff compares each, crunches numbers, and posts weekly totals for the public online. This week saw the state average drop almost 50% in 5 days, but
I've addressed this question before.
Ohio's Chief Medical Officer prefers to share less. 10 days ago, he told us Centers for Disease Control does the same.
When you think about this from a information or data gathering point of view, it is much more reliable to look at those endpoints of hospitalization and death, endpoints which really and truly tell us whether the vaccination is doing what it was designed to do or not.
Even though he supports Indiana's process, Dr. Huth admits getting breakthrough totals
There can be typographical errors.
involves data that could have confusing or wrong information. He also thinks the priority, tracking how effective vaccines remain, is clearly seen in both states. The number of completely vaccinated people dying or in hospitals from COVID-19 is 40 times lower than others in Ohio, 149 times lower in Indiana.
We got to stay focused on one thing. You know, if everybody's vaccinated, there are no breakthrough cases.
Yesterday, Governor DeWine told me that fear of discouraging people from getting the vaccine plays no part in the way Ohio reports those breakthrough cases. His priority, his focus remains on boosting vaccinations. Live in Avondale, Larry Seward, WCPO 9 News.